Hello, Dr. Graziano. Welcome to the BRCD2D meeting. So would you please first give us a little bit self-introduction of your background?
Yes, my name is Graziano. I'm a pharmacologist by training, a life scientist, PhD. Been trained, again, in pharmacology, worked for about a 25-year career at various big pharma, Schering-Plough and Merck. Worked in the cardiometabolic space. Very fortunate to get some drugs to the marketplace from the bench. And right now I've left Big Pharma. I'm consulting and trying to work on initiatives to bring various stakeholders together to drive innovation in the region.
Wow, very impressive. So my understanding is you're going to be a moderator, a speaker today. So would you please give us a little bit introduction of the session that you're going to moderate?
Yes. I'm privileged to be chairing or moderating the session on big data in research and development. And I think it's a very intriguing topic to me as someone who's worked in the basic research labs. For example, things like omics and the like. There's lots and lots of data that comes out of it, and I always saw the challenge of trying to take that data and trying to make sense out of it. My sense of what a lot of data was changed dramatically as we started to work with some of these data sets. And I think really intriguing to me is this notion of how we can take this data and mine it to either learn more about the targets that we're working on, or in a broader sense, the patient populations, and again, to begin to parse out those patients in a way that would allow us to make really more rational decisions about who to treat and how to treat them.
Wow, nice. So, what do you think, a meeting like this, a BRCD2D meeting, how the different population in our research community can use such a platform to advance innovation?
Yeah, I think, if I think of the challenges that we face as a community, I think we tend to be very siloed. We tend to talk to a lot of folks who think like we do and think about the same problems in the same way that we do. And what I find very exciting about opportunities like this, using myself as an example, the notion that I would kind of a priori sign up for a meeting where a lot of IT people would be at, people who think about these big data problems, is not something I would probably gravitate to. But I think an environment like this that brings together stakeholders like myself, along with the various other stakeholders that are here, a broad range of IT people, of people who are involved in thinking about clinical trials. It's really an important thing, because I think in my view, I think other parts of the country with maybe more of an entrepreneurial bent to them, I think that the facilities are there to do that a little more readily. So I give a lot of credit to the organizers for doing this, and I'm really enjoying it and looking forward to the rest of the session.